Hey everyone, thanks so much for joining us for the Health Writing for Health Professionals series. Today we are joined by two very special guests. I have with me Heather McDonald, who is the Senior Director of Patient Journeys at Wildflower Health. And I also have Amanda Weller, who is the Director of Marketing for Encena Communications. Welcome, Heather and Amanda. Thank you so much for being here. As a reminder, everyone, what we're going to be talking about during this conversation is health content and the internet. So, understanding how health information and health technology and the internet come together to really impact patient education so that you understand how they work together and what your patients are actually reading online. So, to kick things off, I would love if maybe we can start with you, Amanda. If you can start by telling us what you do with your respective company and how health content is relevant to your role.
So I've been in healthcare content for about 5 years now in my current role as Director of Marketing at Encena Communications. Encena is a woman-led and organized boutique healthcare marketing agency. So what we do is we work with a lot of digital health IT and biotech companies that are starting out in the healthcare space to get the marketing, the PR, the right press that they need to be able to launch these programs off the ground. It's been really cool because a lot of them are just looking to change the world through these new innovative
Mhm.
ideas, leveraging technology, but they're looking for messaging. And so that's where my role comes in, helping to clarify their story. You can have a really great idea and a really great vision for what you want to accomplish, but at the end of the day, in order to get venture capital you need, or even the customers to buy into the product, they need someone who's able to articulate what they're trying to do. And that's where health content really plays a big role in my day-to-day responsibilities, helping them hone that message, make it clear, make it concise, and bring that unique voice that's going to get them the buy-in that they need to make the changes that they're hoping to make in the healthcare world.
Yeah, that sounds really important. And I also want to highlight that you've done similar work with two other companies, Wealth, WELTH, and also Collective Medical.
Yeah, and they are both really awesome digital health organizations as well. Thank you for spelling it out. It's not WEALTH. It's not a money company. It's a healthcare company for improving wellness. So,
Yes. All right, Heather, would you like to give us an intro and let us know how health content plays into your work?
Yeah, I'm Senior Director of Patient Journeys for Wildflower Health. And what we do is we build our platform supports our clients in engaging with their patients, their employees, and their customers being health plans. So we work with health plans, health systems, and employers. And we are also starting to work in value-based care as well, and some projects with that. So what we do is we're building journeys for users for different health experiences they might be. We're focused in women's health. We have worked heavily in pregnancy. What we're currently doing is building journeys for folks to both support their pregnancy experience, but also attend to some of the maybe more high risk conditions that they might encounter in pregnancy, and then flowing that into women's health as well.
Okay.
So we're building these experiences not only with content that serves content is basically the backbone of what we're doing, but we're also when we say backbone, that's also supporting just engagement of the user and some of the tools that we might use in our application for folks to support their relationship with their provider, with their health plan, and also for them to support their own journey in healthcare and advocate for themselves and understand that the care they're getting and next steps they might need if they have questions.
Yeah, that's amazing work. And I think this will also tie into the next question that I'd like to go into. Many healthcare providers and clinicians are familiar with websites like WebMD and Healthline, but in some cases, that's the extent of the understanding. So, can you share from your perspective, how would you explain health content marketing or product content marketing? Because I know that may be more relevant for you. How would you just, in a very basic and foundational way, explain what those concepts are and how they work? Let's start with Amanda.
okay. So that's a great question. There's a couple of different things. With product marketing, if you create something for your patients or your members, but they don't have any inclination to use it, then that program is only going to go so far. From the product marketing perspective, it's about getting patients, it's about getting members to engage with the programs or the platforms that you've created. From a B2B or business to business side, it gets a little bit more interesting. So Health Leaders, a major healthcare publication, did a study last year, and it showed that 68% of buyers in the healthcare industry look at least two pieces of content. So content could be written content, it could be webinars, it could be podcasts like this, videos before they are open to having conversations with people about making purchasing decisions. And so where content becomes really valuable when you're able to create that content is you're able to help move these leaders, these decision makers, the movers and shakers to adopt new things and maybe break outside the traditional molds of healthcare to implement new technologies or programs and things.
Really interesting. Thank you. What about you, Heather? How does it work in your work, especially when you're talking about patient journeys? I know that content is a huge part of those journeys. So how do you think of content marketing in your work?
So in our work, we consider content marketing the our efforts to provide users within like our application, acknowledging that they are going to the internet for WebMD, but we consider that they probably are folks these days are equipped to use multiple forms of the internet. So in terms of our platform, what we do is we want to build content to provide a well-informed, established bevy of content for things that they might need during their healthcare journey, and provide users with empathetic and clear and accurate content to help support them in that journey. And also providing, that's also a place where we can have our clients who may be health plans or health systems also have a way that they can host their services. So if a mom is up at 4 a.m. trying to breastfeed their newborn, they can look at, okay, they're going to look at some content to help support their breastfeeding. What was that latch that I really wanted to get? What was this? And then there might be a place, there's also resources there for them to locate a lactational support so they can make an appointment, maybe right there, then and there, just to help them through one of the most, can be a really hard time postpartum if you're trying to breastfeed and exhausted and up at 4 a.m.
I always wish that I could see the back end of some of that data, because I know myself, I've been up at 4 a.m. scrolling the apps and either passing the time or trying to figure out what's going on. And I think looking at those activity levels and time of day is very interesting. I appreciate that both of you talked about different types of content and different delivery formats that might exist in, right? It could be written content, it could be a blog post, an article, it could be a video, a podcast. Regardless of the type of content we're talking about, I think we all know that misinformation can be rampant and exists in a lot of different forms on the internet. So from your perspective, how do you make sure that the content your customers are coming across and seeing from your company is accurate and clear and relevant and engaging? How do you achieve that nice mix of good, strong, solid information, but also interesting content as well?
I can start with this one. The company I was recently working for, one of their core values is research everything. So you don't just make blanket statements. You've got to be able to link back to it, make sure your source is reputable. Was a study done in the 80s? Like really going through all of that stuff to make sure you've done your homework. But I think when you have, especially like people who are providers, they're nurses, they're pharmacists, they're doctors who are putting together this content, those individuals have a really unique opportunity to marry not only the data, but the personal anecdotal experience from their clinical practices. A lot of the health content you see online is written by, people like me who've worked in the healthcare industry for a long time. We might understand it, but we're missing the day-to-day, like sitting across from this patient, really understanding what the problem is. And so when you talk about making it engaging and keeping it grounded while keeping it interesting, that's something that is a real strength if you have those opportunities to mix in the data that you have along with those anecdotal evidences, because that's what really makes the article unique to your voice and can make it really interesting and unique for your readers.
Thanks. Heather, what do you think?
Yeah, so we have a stringent, because we have our clients reviewing the content, and of course we are also really mindful about what we're putting out. So we have a set of resources that we limit we don't limit ourselves to, but we have our first top tier go-to resources for whatever topic it might be. If it's pregnancy, it's ACOG. And when we're talking about COVID, it's CDC. So we use those, and then we have a clinical review process where we do use clinical professionals to review the content, maybe act as consultants and subject matter experts in any specialties. And then we have, but it is interesting, I think, when we get down to that's when we have that very clinical, stringent process. But then we also have content where ACOG isn't really going to give a lot of feedback or guidelines on hair care while you're pregnant. And these might be questions that you also might have it for in the morning when you're pregnant and thinking about, oh my gosh, like, how am I going to, you've got 9 months when you're preparing to have a baby. And so there's just so many different questions. And so some of those questions can't be answered. And so what is interesting and what's really nice is when we can use healthcare professionals to help us fill those gaps and do some research and dig a little bit deeper so that we can have it also clinically vetted, but also for those engaging pieces that aren't necessarily a high risk condition, but we want to be there to support and give a really nice some set of information to help provide the best advice or just provide them with information to make a choice for themselves.
Yeah, I appreciate both of you incorporating how healthcare professionals are helpful to you in these respects. I also wonder if, in your experience working with health professionals who are also health writers, if you have also identified places where maybe they have the experience and the clinical knowledge that are really helpful to you in these particular ways, but maybe needing some more support and development in other aspects, perhaps the actual writing work or different aspects of the content creation process. Are there any areas that you all have identified that, like, maybe a health professional who's interested in becoming a health writer or entering this space could probably use some more practice and experimentation with, off the top of your head? I know I'm springing this question on you, but is there anything you can think of top of mind?
I do a lot of ghost writing. And so for those who are like unfamiliar with that term, that basically means that I interview a healthcare professional, might be an ED physician, a chief medical officer of something, and then I write something as if I'm that person. And I think if they do like a first pass at it, the biggest thing that I notice is that sometimes there are abbreviations or like really wordy things that maybe they just aren't familiar with that don't work as well when you're trying to publish or trying to create an article that's searchable. So I think one of the biggest things that I notice when you're coming from a strictly clinical background to a writing background is being able to, you have to think about it like teaching. You can't just talk at the people, but you have to teach them. And so being willing to pare it down, use some of the language that's going to be familiar to them. You don't necessarily want to talk to your readers like they're ignorant or anything, but you definitely want to be able to explain things so that it becomes accessible to a much wider audience than it would be otherwise without that kind of self-editing.
I think it can be really helpful for healthcare providers or healthcare professionals to think back to when they have worked with a patient. And I think what's really valuable there, what can be really valuable, is thinking about when you have had those interactions and working through different ways to maybe help explain something to a patient and conveying that in the content as well, because we're very interested in not only one type of learning, but multiple types of learning, multiple types of ways of achieving health literacy and understanding health education. And so I think disseminating, not just breaking down for one person, but thinking about the different versions that you might break down for different kinds of learners. And also a huge theme of late for us is empathy, empathy, empathy. And so just really putting yourself in someone else's shoes when they're getting, either information, or they're researching something that is just like a sudden diagnosis that they need to understand, and having that tone to help folks access, not only just so they can read for information, but that they can read with a kind of a comfort level that's warm and inviting, and helping them to engage and follow up on their questions.
Yeah, having that kind of companionable, knowledgeable, but friendly approach that isn't as intimidating as it can be sometimes when you come across health content online that's very matter of fact and direct, and like it's not necessarily inaccurate, but it also doesn't make people feel great or empowered after they read it. So I love that. Thank you both for sharing. I know we're approaching the end, but are there any final thoughts you feel like you want to share before we wrap? I know this conversation has been incredibly helpful for folks.
There's maybe one more thing that we're hopefully coming toward the end of the pandemic here. It's hard to really know. We always think, fingers crossed, we always think we're there, and then we get another variant. But this has been a really tough year for a lot of people in the healthcare industry, especially providers and nurses. They're burned out, they're tired, there's compassion fatigue, there's some moral injury that has occurred. And I think it can be a really hard time to be a provider because you look at a lot of news outlets and they tend to focus on the negative, and there's reasons for that. There's negativity biases. This is the reason that we click on those things that they're clearly spammy, but they're like, oh, you'll never guess this one. But as providers, you've done a lot, and you've been able to create some amazing changes. And just because a lot of the media tends to focus on the negative, this creates a really unique space for you to be able to come out and to tell those positive stories, not necessarily in a way that's not honest about some of the hard things that are happening, but keeping those voices positive. So I would just say, if you're thinking about these career switches and trying to find your voice, don't feel like you immediately need to get into that really negative stuff that tends to sell well, or maybe feels a little bit more click worthy or whatever. Like, you have good stories to tell, and people love reading those too. And so don't be afraid to lean into those really powerful experiences that you've had as healthcare providers.
Thank you for that, Amanda. That's great advice. I know a lot of pharmacists out there are going to really resonate with that. Any final thoughts, Heather?
Yeah, I would echo what Amanda is saying. What a beautifully said. I think just understanding that folks who are in content marketing and product content marketing, we're really also equally geek out and love. I love meeting providers, and especially if they're interested in healthcare professionals, and especially if they're interested in content and working on different things. It's just, I think one of our favorite things about this work is that we can still have some really engaging conversations about what's happening in the hospital system, what's happening with patients, what's happening, like how can we best support that? And we're just always really excited to talk to anyone to get their experience. And so that's always of great value to share all around.
Thank you both so much for sharing your insights. I know that with your wonderful work histories, you bring so much knowledge and expertise about health content marketing, product content marketing, healthcare marketing overall. So I really appreciate you being here with us today. And I know that the listeners have learned a lot. So thank you.